Welcome back to Promoting Health Literacy with free information and cool tools from your National Library of Medicine. This is session 2 of 3. I'm Dr. Sandra Smith. In session 1, we learned how to find free, family-friendly information on Medline Plus about almost any health topic. Now we explore what it means to promote health literacy and to empower a person for health. To think about health literacy, we first need to think about literacy because health and literacy are inextricably linked. More literacy translates to more health and more options and opportunities to achieve one's goals and fulfill one's potential. Pause here to tell the person next to you what literacy means to you. If you said literacy is ability to read, you're partly right. The 3 R's, reading, writing, and arithmetic, are fundamental individual skills for gaining knowledge, for understanding information. They're not all that there is to literacy, but they are the essential foundation. Pause again for a minute now and talk about how your life would be different if you had low literacy, low reading and math skills. Here are some questions to reflect on. So life without literacy is limited and full of extra challenges that affect health. Literacy scholars say that literacy in the information age has evolved to include a range of thinking skills and social skills in addition to the 3 R's. And they say that literacy skills always are used for some practical social purpose. It's useful to think about health literacy as one of multiple literacies. This theory of multiple literacies says that each person participating here has at one time many literacies at different levels of proficiency. Each of your literacies enables you to function in some social context. So I know that you have some computer literacy because you're watching these videos. Your librarian wants you to have information literacy, which is an umbrella term, as you can see here on the slide, for many more specific types of literacy. Maybe you have literacy in a language other than English. Each of your multiple literacies is a personal and community asset that you've developed over time with need, opportunity, experience, and support. Note that Q1 in the box in the lower left corner of the slide. This is your cue that the answer to question 1 is on the slide. Keep watching for these clues and completing the handout as we go along. We said that literacy always is used for some practical purpose. Health literacy is used to participate in health care and to take care of self and others. We could make a long list of more specific types of health literacy, like maternal health literacy and diabetes literacy. A mother who has diabetes would need to develop both of those. Here you see the definition of health literacy from the World Health Organization and the answers to question 3 on your handout. You might want to pause here to think and talk together about what type of health literacy you want to promote. Now let's think about health empowerment. Literacy is empowering because it enables a person to increase control over their life. More specifically, health literacy is empowering because, and to the degree, that it enables a person to increase control over their health. We want to promote health literacy in individuals so they can be activated patients and responsible managers of personal and family health and health care. We want to promote health empowerment simultaneously because health literacy without empowerment makes people unnecessarily dependent on professionals. And empowerment without health literacy can lead to uninformed or misinformed, potentially dangerous health decisions. To summarize, pause here and review your handout. Here you see the answers that you should have so far. Now we're ready to talk about promoting health literacy. The health literacy promoter's two-part task is to enable the person to make personal meaning from health and medical information and to enable them to act on it in their real-life circumstances to achieve their desired outcomes. In practice, this means mostly asking questions, reflective questions that require the person to think critically, to reflect, to discover their own answers and motivations. Reflective questioning, or teaching by asking, does not suggest that you forget what you know. Rather, that you will be most effective when instead of telling people what to do, you use your expertise to formulate reflective questions and lead reflective conversations that lead to self-discovery. We'll get practical about that in session 3. Reflective questioning shifts your intention from educating parents and patients in order to increase their knowledge and compliance to empowering them in order to increase their capacity and autonomy. Giving advice and answers, telling people what to do, is efficient, but ultimately it's disempowering because it makes the person unnecessarily dependent on you and conveys to them your probably unconscious image of them as incapable and needy, as a problem to fix. Asking reflective questions empowers them. It shows that you believe the person knows something, that they have valuable experience, that they can figure things out. It lets them see themselves the way that you are treating them, as a capable, competent, resourceful person. As one parent educator described her experience with this method, parents have their own answers. They just need us to ask questions to get them thinking. And that brings us to skills development. To promote health literacy, we want to present opportunities to develop or improve 3 categories of literacy skills, which of course are also health literacy skills: basic, interactive, and reflective skills. Basic skills, the 3 R's, reading, writing, and arithmetic, are a prerequisite for developing health literacy and other literacies. So you may have to address low literacy and promote health literacy at the same time. It's easy and quick to detect low basic literacy skills without testing or embarrassing anybody. Here are some evidence-based, easy-to-ask screening questions. Research shows that having less than a high school education, not reading for fun, and that would include reading to a child, and speaking a language other than English at home, all of these are indicators of low basic English literacy. Not having 10 books means nothing, but a person who has 10 books probably is a skilled reader. On the web page where you found these videos is a link to information on how to refer a person to community-based literacy services and support their participation. Doing so is a great gift that will benefit the entire family through their lifetimes and increase their capacity to benefit from your services. Other often neglected categories of health literacy skills are as important as reading and can compensate for poor reading. Interactive skills are social skills, such as speaking and listening, and they're used to make personal meaning from health and medical information. These interactive skills are used along with critical reflection, thinking skills, to move from information into action. Some literacy scholars describe reflection as the mind's strongest glue. They argue that reflection is so necessary to understand and act on information that it should be classified as a basic skill. So we can say there are 4 R's: reading, writing, arithmetic, and reflection. You promote a person's interactive and reflective health literacy skills by interacting and reflecting with them about their health and its determinants. How to do that in an efficient, empowering way is next. Before you go on to session 3, check your do-it-yourself handout. Here are the answers you should have for questions 5 through 10.